It looks like we can get started now. Thank you for joining and welcome to the VAMS Jurisdiction Orientation Session. I am Captain Susan Pierce-Richards and I am the VAMS lead for the CDC. Just as an FYI, this session is being recorded. If you are not comfortable with that, please go ahead and sign off now. And now I'm going to turn this over to our training team to get to our content for today.
Thank you, Susan. Hi, everyone. My name is Tanya Roberts. I'm a member of the VAMS training team. Thank you all for joining. For those that were not on our kickoff session on last Thursday, we are going to be collecting questions and answers, our questions throughout the session. If you look down towards the bottom of your screen, you'll see the Q&A. Feel free to add any questions as we go through our training session. We are going to go about an hour today instead of 90 minutes. I encourage you to go ahead and add your questions throughout as you're listening. There's going to be time at the end. Don't worry if your question is not answered today. That just may mean that we are not able to give a response right now. We may need to talk to someone else on our team, but we will be answering questions also on our Friday town halls that are at 1 p.m. The invite for those will go out later on today. And then we will be collecting questions along with Poll Everywhere. That's included in the invite. There will also be other avenues for us to get your questions answered, to include frequently asked questions that will be made available with the system. Next slide. All right, as I mentioned, the session is going to last about an hour today, and we are going to go over the 4 portals that are within VAMS, as well as talk about the users. We will look at your specific jurisdiction POC activities, and then we will demo the jurisdiction portal and wrap up with some questions. Next slide. We are in the second week of our orientation series. Last Thursday was the kickoff, and Friday we had our first town hall where we received a lot of questions, so continue to keep those coming. This week we'll look at your roles and responsibilities within the system, and we're going to provide training materials for you to support the clinics or the providers and other users of VAMS. We have plans to have additional deep dive sessions next week, and where we will walk you through the clinic and the employer portal, so there'll be more information coming out about those. And for next Friday, there will be a VAMS town hall, again, where we'll be answering questions specifically about VAMS implementation. Next slide. So today, we're going to talk about your roles and responsibilities, and again, we're going to give you a walkthrough of the jurisdiction portal within VAMS. We are not focusing on the other 3 portals, the clinic, employer, or recipient. We're not talking about policy guidance and business processes or operational guidance. So just keep that in mind as you enter any questions in that Q&A chat. This is strictly about VAMS and the jurisdiction role. Next slide. So let's talk about those portals and how the users will interact with each other. Last week, we mentioned that there are 4 portals in VAMS. Each of the portal has their own distinct set of users. Within the jurisdiction portal, the CDC point of contact and the jurisdiction point of contact will have access to that one. For the vaccination clinic portal, that's where you look at your clinic administrator, the inventory manager, healthcare professional, and front desk. For the organization and employer portal, those coordinators will log into that, and all recipients will have access to the recipient portal. Next slide. As you can see here, the jurisdiction POC is the foundation of the VAMS workflow. We're going to go over the specific activities in a few minutes, but you can see some of the things that they'll be doing in the system. Next slide. As a jurisdiction POC, your role is to set up the clinic administrators and employee coordinators by providing them with information and resources that they need to get up to speed with COVID-19 vaccine rollout, all the plans and VAMS. The vaccine clinic administrators need to understand their staff's role in the vaccine distribution process, where to find the resources to train their staff, and when they should expect to begin accepting recipients, as well as where to go for support. Employer coordinators need to know how their employers Employees can become eligible to receive the vaccine, where to add their employees' information, when their employees can begin receiving the vaccine, and again, where to get support. And we're going to provide you all that information. Next slide. All right, so let's talk about those activities that the jurisdiction POC will do. As the POC, when you go into VAMS, you're going to be adding the clinics and the clinic administrators, as well as the employers or organizations and their employer coordinators. You have to actively manage the list of clinics for your jurisdiction. So that includes adding, deactivating, importing clinic information. And we're going to show you how to do that today. You'll manage the jurisdiction vaccine and inventory and provide VAMS related support to clinics and employers. Again, we're giving you material so that you can perform those tasks. Outside of VAMS, you serve as the primary POC for the VAMS users within your specific jurisdiction, or IIS. We're using jurisdiction because that's the terminology that is in the system, but that also means your IIS. And then identify our IIS awardee, and then identify backup jurisdiction POC. So if you recall last week on the kickoff, CDC is recommending that you have 5 to 6 jurisdiction POCs to perform those various roles. So you should be thinking about who those should be. Lastly, you want to actively communicate with the clinics and the employer organizations, including how VAMS fits into your jurisdiction's overall response plan. Next slide. There are 3 types of clinics that you'll see when you go into VAMS. The standard clinic, that's the one that has the permanent location for a vaccine. It can include your hospitals, your pharmacies, and your pop-up clinics. The second is the mobile clinic. This specific clinic has multiple locations for vaccination. The physical address can change, and it requires a permanent address to receive inventory. Examples of this include the mobile clinic buses or a mobile clinic van. For the third-party clinic, these allow the jurisdiction to establish vaccination clinics at facilities like long-term care facilities or correctional facilities, where the faculty will actually be the administrators of the vaccine to the recipients. The recipients do not use VAMS. This is done by the administrators. And then the third-party clinic is responsible for uploading a list of their recipients, administering the vaccine as part of the normal course of care, and documenting when this vaccine has been administered. The clinics may be closed to specific populations, and they may not be searchable by other users. Next slide. As a jurisdiction POC, you'll have the following, you'll follow the following process for requesting your inventory. The clinic will submit their request via VAMS, and then the jurisdiction will receive their request in VAMS, compile a list of all inventory requests from the clinics within their specific jurisdiction, and then update that inventory submission status within VAMS and modify requests. Each of the jurisdictions can export a CSV file of the total inventory request. We'll show you how to do that today, and then you'll submit that request via the normal process such as VTRAX or your other ordering system. Next slide. All right, I know that was a very quick overview of what you're going to be doing. We're going to jump into VAMS, where JJ will actually walk you through your task. He's going to cover how to add the clinic so that the administrator can register all the clinics, how to add the employers and the organizations so that you can submit your employees for vaccination, how to manage clinics and the employers for the jurisdiction, deactivate clinics, and find and use the FAQs within VAMS. JJ, over to you.
Thank you, Tanya. Are folks able to see my screen?
Yes, we can see it, JJ.
Awesome. So when the IIS or that jurisdiction first gets access to the system, individuals will go ahead and, or individuals will receive an email similar to this. It will have their name and it'll tell them the jurisdiction that they're representing. For today's training, we decided just to go with the IIS named VAMS IIS. You'll click here, which then will take you to a link to create a password. From there, after creating your password, you will land in the jurisdiction portal. Here we see a couple tabs going across the top. We see Manage Clinics. This is where you'll be able to add clinics, deactivate clinics, and look at the status. Manage Organizations. This is where you'll be able to add employers or different organizations that will then later on identify your recipients. The ability to do bulk uploads, we'll get a little bit into that. And then inventory requests. This will be a consolidated view of all the different inventory requests from clinics within the jurisdiction. And then over here in the top right, we have the help, which you'll be able to use to access FAQs as well as log support tickets with the help desk. First, we'll start off with the Manage Clinics tab. Here we can see that there's 4 that have already been loaded into the system. Part of the day 1 activities that we'll coordinate with the jurisdictions is we'll go ahead and help upload the bulk upload of clinics for you, since we don't have the bulk upload option for that 1.0 release. That will be coming at a later time. But what we'll do today is add a single clinic. So here, we'll select Add Clinic, and then we'll add the clinic point of contact information. We'll say Betty Ford. Anything with the red asterisk is a required field. Now, if you do have an individual or a point of contact that'll be an administrator for multiple clinics, not a problem. You'll be able to either do that in the bulk upload, or you'll be able to add them here, and that will give them access to that clinic as well. Clinic name, we'll say this is a mass vaccination at Ford Field. Clinic type, here I do see a couple different options. Right now, the system does operate the same for clinic, hospital, and pharmacy and pop-up, but if you did do a third-party clinic, that would be a setup for more for long-term care facilities. And then mobile clinic would also give you the options to have multiple operating locations for specified durations. We'll cover those later in the clinic training set up for next week. For today, we'll click Clinic, Provider PIN and Facility IIS Facility ID. This will be used for help routing the inventory requests. I'll just put a placeholder in there for now. Email. This is if the clinic does have an email, we can specify it here. Clinic primary address. We'll say it's 200 Brush Street. We'll be in Detroit. And we'll be in Michigan. Zip code 48226 in the United States. If this clinic did have a separate shipping address, we could specify it here. For today, though, we'll go ahead and say that this is operating in the shipping address and the operating location are in the same location. So we'll just go ahead and copy that information. I'll select next. And then here on the third step, we can see that the progress tracker has changed, and now it is on the review. I'll be able to look, scroll through, confirm that this does look correct, select next. I'll get a confirmation that the mass vaccination forward field has been created in the system and is in pending. So go ahead, we'll select back, and now we'll see that yes, we do have the mass vaccination forward field, Betty Ford, the clinic email, and then the status here is pending admin registration. Looking down here at the other clinics, we do see that we do have 3 that are already active, and we're able to click into these. Here we'll be able to see any information in case if we need to reach out to that clinic, as well as an option to deactivate that clinic. You might need to deactivate a clinic just in case if this clinic is no longer needed to serve a priority population, or if the vaccine, if there's a shortage, or whatever other reason that could potentially happen. The jurisdiction has the ability to go in and select deactivate clinic. You will be prompted, however, though, with number of total booked appointments that are currently scheduled at that clinic, and then the number of vaccinations in clinic inventory. So this will give you a prompt just in case if you do see that they do have inventory and they do have some scheduled appointments and you don't want to deactivate it just yet. You'll have the option to hit cancel, or if you still want to go ahead and deactivate that clinic and cancel all future appointments, you can select deactivate. Clicking this top logo, we'll go back to the home page, and now that we can see West Warren Avenue Minute Clinic is now inactive. When you first click into the jurisdiction portal on day 1, you do have the ability to bulk upload the organizations or employers yourself. So this is a screen that you will see. It will be blank at first, but you'll be able to select import organization list to do the bulk upload option. And then the templates are always here within the modal to then download. We do present the Excel template in an Excel file so that we do have the option to put drop downs just to help keep the data entry going in clean. Anything with an asterisk mark will be required. When you do save it though, you will need to save it as a CSV file to your local machine, and then you'll be able to re-import it. I do have one that's already created though, and we'll open it up actually real quick just so we can take a look at it. Here's the success message though, so it was successfully uploaded, and we'll actually get a review on status output here shortly. What we should see is these 2 rows would be successfully added as organizations. This third one will be a failed one just because we do not have the organization point of contact email. Now you're able to upload up to 9,999 at a time, and that can take a couple minutes. So we do have a notification that emails to that individual when their import is complete. Here I can see that the organization import attempt on 1013 has been processed by VAMS, and it does have a link to go ahead and click right into it. I can access that import file by coming in here. I can see who it was created by, the date. Here's the original file, and then here's the result for the bulk upload. We can see the status column is now added. And actually, it looks like I did not have the valid organization pick list, and I actually did not complete the all fields. If I had completed the template correctly, it would have said completed, and then these organizations would be popping up within the employer portal. If you do not want to use the bulk upload option, you're able to select add organization and do it one by one as well. So here, we'll go ahead and say Miss Diana Ross. And then we will use another email address. Here, I'll specify that organization's information. We'll say that this is the Detroit Nursing Association. And we can categorize these organizations. So we'll say that these are healthcare providers. Organization address, we'll say is 2799 East Grand Boulevard. Still operating within Detroit. Go down to Michigan. We'll get the zip code. Phone, website, and email. These are all optionals. So we'll go ahead and skip those today. Now, we do have this option down here, policy-enabled registration. If this organization did not want to go ahead and specify the recipients up front, either through that bulk upload or this individual adding each employee once we get into the employer module next week, they're actually able to go ahead and specify domains that the employees or members of that organization are allowed to register from. So here, if I put cdc.gov, once Diana Ross gets this email, she can send this out to anybody, and anybody with that cdc.gov email address will then be able to register within the system. We do have tooltips here to help to provide additional guidance. For today, though, we'll go ahead and just create a normal organization, one that would have to identify their employees. Similar to the clinic, we do give them the ability to go ahead and review one more time. The information looks like it is correct. We'll go ahead and select next. And then we'll go to the state portal. And then if we go to our managed organizations, we do see the Detroit Nursing Association. The point of contact is Diana Ross. I did not specify an email for the Detroit Nursing Association, so this field is blank, and the status is pending since I have not gone in and registered this organization yet. Moving along down the tabs, we do see this inventory request. This is still the full features for the inventory are still being built out. What you'll see in later releases is the ability to export this, and then it'll be in a file format that is digestible by VTrax, and then we will have an import option to help track those shipments. But here I can see that the clinics that were within my jurisdiction, they did request different products and different doses. We can click into each one and look at additional information. So here, we can see that the inventory has been submitted by the clinic. And then we also see the different clinic details here. In later releases, the jurisdiction will be able to modify these clinic order requests. They'll be able to change the status, and then they'll actually be able to update the product and doses requested, so that when they do export this file into a format ready for VTrax or another ordering system, it'll all be there in that export nice and clean. Over here to the right, if I am modifying this and I do want to let that clinic know why, I can go ahead and type in anything here to let them know. So we can just say, for example, vaccine shortages will require a lower shipment for this clinic. I can share this, and now the inventory manager within this clinic can either respond to this or just go in and read it and then know that, yes, my order was updated, and I'll have a reason why. If I do want to track a specific order for any reason, if there is a lot of back and forth on it, I can click follow, and this will actually send me email notifications. The clinic itself will also have the ability to follow their different clinic requests in case if they do want to keep a closer eye on it, or if there's somebody else in the clinic that wants to just make sure they're up to date on their inventory updates. Navigating back to the main page, the last thing we'll touch on right now is this help. Each module will have tailored FAQs that'll all be searchable. We do have a couple in here in the lower environment just to display for an example. You'll be able to search here. So if you are interested in which browsers are best for VAMS, you can select here, and then you'll see FAQs. Additionally, you do have the ability to submit a question. We'll be updating these drop-downs, but there's different questions here that'll help filter the answers over here on the right. So if we wanted just to say other, and we had something related to a browser issue again, we could start typing in the description, and we'll actually see the FAQs being filtered over here. I can click and say if this was helpful or not. If it was not helpful, I can always hit exit and then continue to submit my question. From there, the help desk agent would then be able to respond, and then you could go back and forth in your email until you have a resolution. Last thing we'll show is just the logout. You'll select logout, and then you'll be able to navigate back into this portal at any time by using the landing page, selecting login. We do have multi-factor enabled, and we also do have CAPTCHA since we are taking security very serious for this system. So we are putting in those proper safeguards. That is, though, the walkthrough of the jurisdiction module. I'll hand it back over to Tanya.
Great, thank you so much, JJ. I'm sure you all have lots of questions, so definitely please go down to that Q&A chat and enter them there. As a reminder, if we do not get to your question today, we will be getting the response so that we can get it out to you at a later date, but that information is coming over. I will turn it over to Susan to start our Q&A portion.
Thanks, Tanya, and thanks, JJ, for that demo. Again, get those questions in. We will answer as many as we are able.